Welcome, everybody. We're just going to wait another 2 minutes, and then Nadia is going to chair this session for us. But thanks very much for joining. It's nice to see some of my team members here. And we're going to be using the Q&A function. So if you have any questions, either write them down on a piece of paper, and the intention is that we'll have plenty time at the end of our formal presentations for our questions and answers. Thank you.
So good afternoon, everybody. I send you a warm welcome. My name is Nadja Nestler, and I'm one of the nurses who are responsible for the EFIC EDPN examination and the European Diploma in Pain Nursing. And thank you for joining this webinar. We want to give you some information about this EFIC EDPN examination and the European Diploma in Pain Nursing. And so for that, please, Angela, next slide. We want to give you some information about the EFIC curricula, the European Variation in Training and the development of the curriculum, and then we will give you information about the diploma examination and what you have to do or what you can do. And we will do it from several perspectives, so it's not me alone who is speaking, it's also Felicia Cox and Martin Gelligan, and the others of our group will also give you some answers in the Q&A session part. Okay, Angela, the next one, please. As you see here, the EFIC, the European Pain Federation, developed different curricula for the doctors, for the physiotherapists, for the psychologists, and also for the nurses. And this core curriculum for the European Diploma in Pain Nursing was developed in 2018, and we could offer it in 2019. And after that, we had a short break and then developed the examination to have then the European Diploma in Pain Nursing. The next slide, please. We think that this is important and necessary because we have so many variation in Europe, as you see on this slide, and it is a possibility to have a diploma in pain nursing around different countries in Europe, and therefore we developed the curriculum, and therefore we also developed this examination. Then when we have this examination and when you have this exam and the diploma, then we have all the same status in pain nursing, and we can present that we have knowledge and we have competences on a European level. And therefore, we think that it is important and also nice to have this diploma in the next time. Okay, Angela, thank you. What is the role of specialist nurses in Europe? And you see that we have variations in the roles in practice, and also we have many variations in the educational preparation. So we have some countries with studies, we also have some countries with vocational training, and also it is not the same availability of education in all countries, and therefore we have established a standard for competencies across Europe with the core curriculum, and we have now the possibility to have the same education and the same examination, and to present our knowledge and our competences in pain management. In our opinion, the European Diploma in Pain Nursing has potential benefits for patient nurses and organizations because we have an accreditation in pain nursing, and then it is visible that we have a professional qualification. We know that there are barriers in different countries, for example, about the access of information, but with this diploma, we can give all the necessary information about what pain nursing is, what we are able to do, and what are our competences. And we also think that there is an importance of specialist nurses because the situations of the patients with pain are very complex, and it's not only the task for doctors or for physiotherapists. Nurses are very important in the pain treatment, and we have our own knowledge, our own competences, and these are important for the patients and for the treatment. And so we need specialist nurses, and then we have an impact on practice and also on other professionals. The next slide, please. Here you see all the women who had developed the core curriculum. So it was Dr. Rianne van Buckel from the Netherlands, Dr. Emma Briggs from the UK, Dr. Susan Brokmans from Belgium, Professor Dr. Emila Gnas from Germany, Dr. Martin, I don't know to speak it in the right way. We also said Martin. And also Dr. Petra Mendesova from the Czech Republic. It's me from Austria, and Professor Pat Schofield also from the UK. And now I gave you a short introduction, and I want to give now the talk to my colleague Martin. Please, Martin.
Thank you very much, and thank you for the lovely introduction, and just a massive thank you for all the hard work that you and the rest of the team put together in developing this curriculum. I mean, I remember when it first came out, and it was a bit of a revolution. We had to say, my God, it's final recognition of the fantastic work that specialist pain nurses do, and to have that core standardization across the board, it was so important. And now to be a part of the group, to take it to the next stage of doing the exams, it's really humbling for me to be here, so thank you. So I'm just going to talk to you a little bit around the structure of the curriculum and to give you a bit of a sense of what's in there and what the expectations might be for when you come to do the exam. The structure of the curriculum, it covers pretty much all aspects of specialist pain management, assessment, and within specialist populations as well. It also helps to capture the complexity of the job that you do every day as a specialist nurse. So not only your expert knowledge around the subject matter, but also the expertise in managing services, being a leader in audits, research, patient education, improving quality of care as well. So the document itself gives you a really nice grounding of every single aspect of care that you do and how you can really demonstrate your expert knowledge. Next slide, please. So just to give you a little bit, some examples of more of the detail in some of the areas. So the principles of pain treatment, again, this is a massive area. So within the core curriculum document, it's broken down into subsections as well. So you can really demonstrate your expert knowledge across all the subdomains within this. So examples of this would be around promoting self-management, the role of non-pharmacological interventions, then the pharm, interventional therapies, and then the management of comorbidities as well. So again, another great opportunity to really showcase the expertise that you'll have as specialist pain nurses. Next slide, please. Now, the first sort of 4 domains within the curricula are fairly generic to all paid nurses, regardless of your setting, but then it's in domain 5 that you're really able to hone in on your specialist area of practice, because some of you will be working in very, very specialist areas. And the great thing about the curricula is that it allows you to not only demonstrate your expertise in pain in general, but to then really demonstrate and showcase your expertise within your specialist subgroup of pain. So for example, mine would be cancer-related pain. Now, the subgroups within the curriculum, they're relatively extensive again, so they cover the whole age range. So we've got from adolescents all the way up to adults, older adults, and also different subgroups as well, from cognitive impairments, intellectual disabilities, cancer survivors, torture survivors, substance dependence, and critical care and trauma as well. So there's lots of room in here that should meet everybody's individual needs to really showcase what you do every day in practice. Next slide, please. Some of the so this is just an example of the competencies themselves. So the wording is fairly standardized across all the domains, really. It does use a bit of that academic terminology. So it's a lot around demonstrating ability, demonstrating use of person-centered approaches, or that sort of demonstrating knowledge and understanding. It just really helps you to sort of dig down into the expectations under each of these domains, so you can really map where you are now to the expectations within the curricula, and again use that as a jumping point to say, well, are there any knowledge gaps, are there any areas that I need to improve on before I come on to the exam? But we'll talk a little bit more about that towards the end, around the support that we can do in managing that as well. Next slide, please. So the benefits, you're going to hear lots and lots about the benefits. I'm just going to briefly talk to you around sort of the eligibility and the criteria for coming into this. So the main criteria that we've set in order to come in to do the exam is at least 3 years of post general experience. So once you've completed your nurse training, you're 3 years clear, and you've got a really good grounding and a good basis within your speciality, not only within pain, but within your subspeciality as well. And I think we all agreed this was really important, because we wanted you to have a really solid basis to really demonstrate your expertise and show how you're hitting all the benefits of the curriculum. Now, this is a really fantastic opportunity to recognize your achievements, your personal and professional development, and you're going to get the backing of a major European organization as well. So how often do you come along and you can say, well, you know, I've done this European diploma, I've been rubber stamped by EFIC. They recognize that I am an expert in my field of practice, and I've met all these competencies that were set by a panel of expert pain nurses as well. So I'm ready to then take on the next challenge in my career. So this is a fantastic opportunity to do that. So I'm going to hand you over to Flick. He's going to give you a little bit more details around how you demonstrate that expertise and how you're going to achieve that EDPN.
Thanks very much, Martin. May I have the next slide? Thanks, Angela. So I think you've probably got some really important questions. When? How am I going to prepare for this? How much is this going to cost me? And what am I going to get for it? So I'm just going to take a very structured approach to this. So historically, the physician exams and the physiotherapy exams have been done separately, with the multiple choice questions being done in advance, being marked, and then a decision is made, pass or fail, and then you move on to doing your Viva. But actually, we just thought we would like to start off to have it all on one day, in one place, and all in person, because of technical, well, to be honest, the practicalities. So the examination will be held on one day, which is a Friday, on the 24th of May, 2024. That's this year, in a few months' time, in central London at the Royal College of Anaesthetists. And we chose this venue, A, because we're very familiar with it, but B, actually, it's really easily located. It's very close to train station, central London train station of Holborn. So we have initially, part 1 is a multiple choice questionnaire, and this will be undertaken from 8:30 in the morning till 10 o'clock. And then we have a break. We have a number of expert examiners who are helping us on the faculty. So we have collaborated with Professor Pat Schofield, who is part of the initial development team. And we also have the expertise of Professor Kate Sears, who's coming to join us, as well as Margaret Dunham, who'll be well known to all of you who have experience or interest in pain in older people, and a number of other local nurse consultants, including including Dr. Jill Chumley and also Karen Cannons. So I'm really thrilled that we can chair this in one day in London. So then part 2 is a Viva, and you'll be in advance of the examinations. We will ask you to submit 2 complex case studies. We have a pro forma, so you don't need to worry. They're not too long, but what we want you to demonstrate is knowledge, not only of the recognition of pain, but actually your assessment of pain, thinking about the differential nursing diagnoses and actually maybe what is the communication that you'll be sharing with your patient, agreeing a shared care plan, and then undertaking a therapeutic intervention and then assessing the effectiveness of this. So to prepare for the examination, the EFIC Academy already has a significant amount of content, and we have another academy event immediately after the examination where we're just tapping into some super specialist content that's not already been covered within the other disciplines. So we have the QR code there that will lead you directly to the web page, and on the web page is we have some tabs where you can press how do I prepare. What will the examination look like? We have 5 example multiple choice questions just for you to get a feel of what level of expertise, understanding, and what our expectations are as examiners. Next slide, thanks, Angela. So the practicalities. The first thing that you need to do on that web page is actually an expression of interest. So this is essentially just completing a form saying who you are, what your name is, and then you will receive an invitation from EFIC. And EFIC will then ask you to confirm that you meet the criteria for the examination. You then apply, and you provide us not only with an English language copy of your curriculum vitae, proof of your nursing registration in your country, copies of any higher degree, plus additionally a letter of support either from your employer or perhaps if you're a standalone, perhaps endorsement from maybe someone who is an EFIC counsellor or somebody else that you know within EFIC that can provide us with some veracity of your expertise and your experience. But at the same time, people always want to know, how much is this going to cost me? So significantly, we have negotiated a very low fee of €250. But if you join the EFIC Academy and the price of that is overleave, you get a 25% reduction, which essentially means that you'll break even. So most people join the EFIC Academy to allow them to prepare for the examination if there are perhaps subjects, expert subjects that you don't know much about. So for me, for instance, when I first read the curriculum, I thought, actually, I don't know much about neuromodulation. But then when I looked in the academy, there's a lot there about the nursing role of neuromodulation. But also I found other content within the physician academy sections. So it is there because we have mapped everything against the core curriculum. We have mapped all of the academy content. Now, and your application will then be reviewed by a member of the team, and we will decide if you're eligible. So do you meet these criteria? It may well be that you've not quite had enough time in clinical practice. It may be that you've come from a less specialist area into a more specialist area. But we will provide you not only with some feedback, but actually, if you do meet the criteria, it's a first come, first serve. You'll receive an examination place. Now, most importantly, not only we have to pay your fee at that time, but we only have 20 places. Now, this is far more places than any of the other disciplines, and this is our first examination. So we're running it in English because English historically has been the language of EFIC. But when I was invited to a meeting with Sam Kinman, who's the executive director, and the members initially of the nursing group, I expressed my concern about the fact that nursing is pan-European, but not everybody's first language is English. And how can we expect a nurse perhaps working in Latvia who has limited English, although maybe working at a highly specialist level, to undertake an examination in English? So later this month, we're going to be sending out an email from EFIC asking if perhaps you would like to undertake the examination, but perhaps your native language is German or perhaps it is another Slavic language. And then we will consider, based upon the number of responses that we get, we are going to then offer the examination in alternative languages. So the Viva will be in English, the Viva will be in your native language. And we're thinking that, or we're predicting that German will in fact possibly be one of the most common languages spoken. So we are preparing for both a German and a Dutch examination in the meantime. Next slide, thanks, Angela. So as I mentioned, the EFIC Academy has a cost for nurses at €75 per annum. But as I mentioned earlier, you break even. Now you get free historical access to all the recorded content of every single Academy Pain Summit. You'll also get a fully funded place at the EFIC Academy Pain Summit in May 2024. And this contains 2 whole days of nursing content. And I'm delighted that Nadia Nestler, my co-chair for this group, and also Dr. Marta Verlecker are actually co-chairing this. So there's lots of content. We are covering cancer pain. We are covering opioid scrutiny. So there's lots of different subjects depending on which clinical area you're working in, or perhaps like me, you have deficiencies in certain things in preparation for the examination. Next slide, thanks, Angela. So why should you do this? And I'm going to hand over now to Martin, who's going to explain why UK and Irish nurses should consider doing this. Thank you, Martin.
Thank you, Flick. It's a great question, isn't it? And I think it's a question we get a lot from a UK and Ireland point of view, because at the minute there's a lot of debate locally around advanced level practice, advanced level accreditation. There are lots of different organisations that are asking you to accredit with them, whether it be the RCN, NHS England, NHS Scotland. There are lots of opportunities to sort of demonstrate that level of advanced level practice. However, this is the only accreditation that you'll get that will endorse your expertise as a specialist pain nurse, essentially. The focus in the UK at the minute is very much around advanced level practice, but it tends to have more of a generic focus and less of a speciality focus. Whereas the European Diploma in Pain Nursing is a really great opportunity to endorse that specialist expertise that you have as a pain nurse. So I think this is a fantastic opportunity to use it alongside some of those other qualifications you may have if you've got MSCs in advanced practice, and to then just really endorse that you are the expert in pain and you are the expert within your area of pain as well. So it's a really nice additional string to your bow, and it's a really strong position for you to then move forward to demonstrate how you can change and improve on practice within your specialist areas. So yes, it may feel like another qualification or another hoop to jump through, but actually in the longer run, it is going to put you in a really, really strong position for having some of those more difficult conversations with the bigger stakeholders around, well, I'm ready for a nurse consultant position, or I'm ready to move into an academic position where I am the expert in pain, because this is going to really sort of give you the backing to support that. That's my UK sell. I'll hand you over to my colleagues to do a bit more of a sell from the Netherlands and Germany as well.
So Nadia, I wondered if you'd like to speak to this.
Yeah. I searched for my micro. Thank you very much. So we aim to offer an exam in German and in Dutch in 2025. And this is because we think that this diploma guarantees that the skills of Dutch as well as German-speaking nurses meet European standards, and that you or your colleagues are visible in the European country. And we also work together with the Dutch pain nurse group as well as the German pain nurse group. And so it is possible that the national pain nurse diploma are incorporated in this diploma. So when you have the knowledge and the competences to get the Dutch pain nurse diploma or the German pain nurse diploma, it is also possible for you to take this diploma, the European one.
now I think it's maybe time for answering the questions we have in the FAQ part. So, Flick, do you want to answer some questions? So,
Thanks very much, Nadia. I'll just ask Martin perhaps to address the first question. So we have a question from Emily. What reasonable adjustments can realistically be put in place to support people who perhaps are neurodiverse during the examination day? And I know that we have already planned some reasonable adjustments, such as adjustments for the length of time for the multiple choice questions. Yeah. So perhaps if you could just expand on that, please. Thank you.
Yeah, I mean, it's a great question. It's a really important question as well, because, you know, you can probably tell that we're really keen to support all paid nurses to undertake this examination, and we want to support them in as many ways as we can. So what I would normally say in the first instance is anybody that has additional learning needs or is neurodiverse, please reach out to us at the point of application so we can discuss them and find out what works best for you in the past. What's, you know, what are the things that we can do to help support you through this process? And as Flick said, that will probably be around things like additional time to undertake the examination. It could be that we provide additional support when you're developing the case studies. Whatever that may be, just let us know and we can have that conversation and we can put in the support in place to get you through it.
Thank you so much. And a second very important financial question from Emily is, what happens if you submit your application? And I have to say, we're not quite as, I think we're more realistic about somebody may forget to upload something. So therefore, we would reach out to you and say, actually, you have failed to address this and you have omitted your letter of support from your employer, etc. We would not automatically dismiss you. We would just remind you to do this. But your fee is repaid less a 10% deduction. So you'll receive back 225 euros, meaning that it will cost you 25 euros for this application. So, and bon dia to Karina, who joins us from Portugal, who possibly, is it possible to have the examination in Portuguese? Now, that's a very important question, because when I was planning the timings for the examination in English, when we're thinking about the number of people, so we have 2 experts, and bearing in mind that there are a significant number, if we think about membership of the Paid Nurse Network, and we're planning that the majority of nurses who will be undertaking the examination in the first cohort possibly are native English speakers, maybe based in the UK, Ireland, or perhaps in the Netherlands, or perhaps in Belgium, who may be multilingual. We have had to factor in the fact that for every one applicant, we need to ensure that there are no overlaps and no potential sources of bias, because often nurses in the UK are well known. They're in, their team lead, for instance, may be me, and so therefore for instance, my team who plan on undertaking the examination will definitely not want to be interviewed by me for their viva, nor by Martin, who perhaps has been one of their team leads, nor by Jill. So we're going to have to factor in a pair of expert examiners for each of the applicants. Now, bearing this in mind, we think we have planned for between 12 and 14 expert nurses to run the examinations to facilitate these for our 20 applicants. So we have managed this, but this is one of the thoughts going forward, is that if we're thinking about if the next examination was in German, and I look to Nadia here, Nadia has a cohort of native German-speaking nurses, but also she might need to employ people from other disciplines to support the examination going forward. So we are very, very keen to perhaps have some non-native English speakers undertaking examinations very early on, who can then, if they pass the examination and meet the criteria, could perhaps then be invited to become examiners in the future in their native language. So this may be, we predict it will be German and Dutch. So So to run the examination in Portuguese, Karina, we will need some native Portuguese speaking nurses that can facilitate the examination in your language. And this will take some because you'll be having 50, correct me if I'm wrong, 50 multiple choice questions in a 75-minute period. So there will need to be lots of translations and testing of the content. So I cannot see or I cannot predict that we will be able to undertake the examination in Portuguese until we see until we do our survey, and that demonstrates to us that there's a significant cohort of Portuguese-speaking nurses that are willing to undertake the examination. Now, I don't know if Martin or Nadia or Petra would like to make a comment about this. Thanks.
We also have the question from Patricia, whether the diploma is at level 5 or level 6. And we decided that both is possible. So if you have the European qualification level of 5, you can attend to this examination, as well as if you have the EQR 6.
May I just ask Patricia, just to pop it in the chat, where she is based? Because I wonder, Patricia, are you talking about the UK standard diploma level? Or perhaps I'll ask Martin to address this for me as an educationalist, because we are talking here about the European qualification framework, not the UK one. So I think, Patricia, it'd be very handy to know where you're based. Perhaps you could unmute yourself if possible.
She wrote that it's meant UK standard. She's based in the UK.
So what we've done, we spent a lot of time mapping against the European standards. So it will be the same. So it will be a degree level, so a level 6 from a UK perspective.
Another question is how the content is shared prior to the examination. So I'm not sure what is meant. You are able to read literature, to be a member of the EFIC Academy. There you have really many contents to videos, as well as other possibilities to learn something about pain and pain treatment. And the content of the examination is that you will get the standard for the viva, and then you have to send us your vivas, and we will decide which one you have to present, and we will discuss afterwards.
I might just build on that. Thanks, Nadia. So on our website, on the EPDN website, as part of the EFIC website, we have there everything really that you possibly want to know. How do I prepare for this? What does it look like? We also have a reading list for you, and we also have some example content. So Kelly, I just wonder if there's anything else more specific that you are referring to. Would be handy. Sorry, I'm slightly, I'm not quite sure what you're asking. Yeah, sorry. Thank you.
Mm-hmm. Then we have a question maybe for Martin. Can you just discuss again the reason for doing this if you already have a postgrad qualification in pain, whether that's a degree or master's in pain and advanced practice, please, and thanks.
It's a good question, Neve. Yeah, thank you. And again, it's a question we're hearing quite a lot from a UK perspective. What I normally say is that people who have got previous qualifications either in pain or in advanced practice. In the UK at the minute, there isn't really a standardized approach as to what's included in those undergraduate and those postgraduate qualifications. So there's a lot of variation around the level of knowledge and depths that go into it regarding the different aspects of pain, essentially. What we're offering with the EDPM is that this is the curricula, this is the agreed standard across Europe around what is expected of specialist pain nurses, as it's been developed by the expert panel back in 2018. And therefore, when you complete the exam and you have the European diploma, you can hand on heart say that everybody who has it is working at exactly the same level, because they've been able to demonstrate expertise within the core domains of specialist pain nursing. Where it becomes a little bit more tricky if you've done advanced practice education or if you've got a pain MSc from different universities, their focuses will be slightly different. Whereas this one, you know exactly what the focus is, you know what the standards are, and it is very, very tailored to specialist pain nursing.
It's very interesting, Martin, because we know that Neve is based in Ireland, and we're delighted to have Joanne O'Brien now on the EFIC board as an elected member. And Joanne and I have had significant conversations actually about the lack of opportunity for nurses in Ireland to undertake now going forward highly specialist pain education at master's level. And Joanne thinks this certainly fills a gap. But my plan is to undertake the examination myself. I mentioned this to Martin and Nadia before we commence the webinar, because I want to test the content, and I want to test myself, I have to say, and I want Martin and Nadia to mark me. And I also think it's really important for us to recognize actually how difficult or how easy or this content is going to be able to generate it. We have spent a lot of time planning this, and historically the physios have used OSCE, so they've undertaken physical examination. Now I know, because if we're thinking about pan-European, because we have to recognize actually the wide level of variation in skill and access to postgraduate education, that maybe it is the norm in the United Kingdom and Ireland. I'm just talking about, for instance, where we undertake structured physical assessment courses. We are non-medical prescribers, and also we are generating care plans and undertaking, advanced physical assessment. This is what is expected of the physiotherapists, who often have to do an assessment on lower back pain with a simulated patient. But because nurses in Eastern Europe, for instance, do not do this level of physical assessment, we have had to compromise. And we want you to demonstrate your highly specialist knowledge, skills, and ability, both mainly in the Viva. And having done some Vivas recently with Martin, it's very interesting to complete, multiple choice questions, because you're really, really testing yourself against your test. But actually, the Viva makes you reflect. And I think reflection is one of our most important skills. What was my assessment? How did the patient present to me? What was my nursing assessment? What would be my nursing diagnosis? What conversation do I need to have with the patient? What plan do I need to agree with the patient? And then just coming back to the work Nadia's been doing about checking their understanding of this, and then testing them and getting them to teach back to you what their understanding is. And this is what we want from the Viva. So it's not a highly technical thing like the physiotherapist or the physicians. This is a nursing Viva for nurses, run by nurses. And I think that's really important, because we've never really had this opportunity before. And I'm just really delighted and thrilled to be part of it. So I hope that answers.
I think I want to add something, please, Flick. So I think you see this when you open the template for writing the Viva, then you will see that it is really the nursing process we want to see and we want to read. And in this nursing process, you have to demonstrate your nursing expertise in pain management. We also have a question to the multiple choice questions, and Dee wants to know whether there are some examples
of the MCQs. And yes, we have some. We have some also on the website. There you can see, I think, up to 5 questions. So you have an idea what you will have to answer when you will have the examination. We also have another question from Emily. She wants to know whether there will be any discounts on local hotels similar to that of conferences, or is there enough attendees to secure a discount?
That's a very interesting question, because we know that accommodation in London is very expensive, but we've factored this in with our timing. So we're starting at 8:30 in the morning, and depends where you're coming from, but I have not done that. I've only asked EFIC to secure accommodation from our what is the word? The faculty that are coming from Scotland, for instance, and Wales. So no, at present, no.
Mhm.
Yeah.
Okay.
But then, because it is on a Friday, you might want to think about making a weekend of it. It's just a suggestion. Does anybody else have any other questions? Maybe we could go to the next slide. Thanks, Angela. So I think that's a very interesting question. What would encourage you to take the examination? Because if you visit our webpage, I think you'll find that there's every possible resource there that you could possibly want. Why should I do it? Some examples of multiple choice questions. We have even produced a pro forma for the, what is the word, the complex case discussion for you, and with some guidance about word counts, the number of references, etc., and what the expectations are for that. So are there any particular country associated barriers, apart from obviously our inability, Karina, at present to be fluent in Portuguese? But what's interesting is that one of the nurses in my team, who I think plans on undertaking the examination, is an interesting position in the UK, because he has undertaken our generic advanced practice master's qualification, which is not a specialist qualification, yet is working at advanced practice level in pain management. So already we might have one possible person who might be able to lead the examinations, who I think would be delighted to head back to Lisbon or to Porto. So any other particularly country associated barriers that anybody can think of? So Neve has mentioned one about, already holding a master's level qualification, but I think Martin has explained quite clearly about there's no particular standard related to this historically, and that the EFIC examination and diploma and curriculum sets the standard. I'm going to be quiet now for a little moment.
I'll just jump on the back of that, Flick. So some of you may have been aware of the work that myself and Flick have done in the past around the RCN Pain Career Framework. And actually, when we revamped this and updated it last year, we also aligned it to the EDPN as well. So it's future proof. So our method to our madness really is to start to bring in that standard of, okay, you're working as a specialist nurse and an advanced nurse practitioner. What would we expect you to have? And if you look at the UK career framework for pain nursing, at that level of specialist nurse, advanced practitioner, consultant, the EDPN is in there. So we're trying to sort of build in that aspect of, okay, we know there's an issue, we know there's lots of variation. What are we going to do about it, since we're the ones that are sort of dealing with the issues? And this is the first big step to doing that, to say, okay, this is a core curriculum, this is a core standard, and this is how we're going to benchmark against everybody moving forward, hopefully.
Emily is asking whether it would be possible in future to have a virtual option for the exam, because traveling long distances as a disabled person can be quite difficult, and she has a lot to plan, and it's a lengthy process, and therefore she is asking whether we can do it also online in the future.
that is a very valid question and very valid comment, actually. Historically, as I mentioned, the simulated patients and the advanced physical assessment examinations have been done in person by the physios and the medics. Now, our examination is completely different. And there have been some challenges because when you undertake the multiple choice questions remotely, there is a requirement for EFIC to have software that surveils you. So it means that you cannot use any other devices. You cannot move your eyes, and you have to stay in that one position for that length of time. So that may also be a challenge for people that perhaps have restless legs or need to move or to reposition. So I need to check with the team about that. But certainly I cannot see any barriers in the future, bearing in mind this is our first time, and the people that are going to be undertaking this examination are our test subjects, that we could not offer this remotely. Emily, I think this is a really, really valid point, and thank you very much for raising that. And I will certainly get back to you personally with this. Thank you. Sorry, the other thing I needed to say was to undertake the MCQs remotely, you also need to download software. Now, this historically has been very challenging depending on your device that you're using. And I know this because I went last year to go and observe the physical examinations of the physiotherapists in Leuven. And they were talking to me in between the breaks, just saying that it was a real challenge, actually. To download the software was the biggest challenge. And then to sit still during the MCQ examination was the second barrier. I've never used this software, but I wonder if any of the educationalists on here have.
Me not.
That's a no from Nadia and a no from Martin, but this is something that is coming in. The other concern that we have is around the use of artificial intelligence to generate complex case studies, for instance. So we'll be using some software for that as well. Mm-hmm. Do we have any other questions from anyone? Oh, April says she's happy to be a test subject. April, get your submission in. Yeah, we'll just have to be quite careful about who your examiners. But I think this is one of the beauties of submitting your case studies in advance, and we know who you are in advance and where you're based, because then we can look at biases, and we will then collectively assign the vivas to individuals where perhaps you have no strong association. And of the two complex case discussions that you'll be submitting, we will only choose one, to be honest, because what we want is for you to demonstrate your understanding and the depth of this across a wide range of settings. So it may be that you have, what we don't want is you submitting something about acute postoperative neuropathic pain, and then a complex case study on somebody who has got complex neuropathic chronic pain. So we have some categories as well within the vivas, and you can tick some boxes, and they're on either side of their what is the word? It's I don't know, it's an either or. So it must make sure that it straddles across populations. I thought I just saw another new question pop up, but maybe I think I'm frozen.
No, there's nothing new.
Okay.
There was a couple of thank yous coming through, which was really nice to see. Yeah.
Oh, thank you very much. So if you have any other questions, feel free to contact us outside of this website. We can pop our names in the Q&A now for you. I think probably most of you can contact us through social media. We have very strong, if you're still on Twitter, formerly known as Twitter, on X, you can direct message us, or perhaps maybe pop a comment in under our under EFIC or contact EFIC directly. But we're very happy and we're thrilled that so many people have expressed an interest and joined us today. So there's always questions that'll pop up after the event. You think, why on earth didn't I ask that at the time? Just hand over to Martin and see if he has anything else to say. And I noticed that we've also been joined by Jeanne van Bukel, who was one of the founder members of the curriculum. Here she is, she's popped up.
Sorry, I was a little bit late, as you might have noticed. But I'm very delighted that there were so many participants, and I'm looking forward to the exam days.
Mm-hmm.
Yeah, just echo that. Thank you all for your interest and for coming today, and thank you for flicking the team for pulling us all together. And you know where we are. If we can be of any help or any support, just let us know. Even if you're worried about it or you're not sure if it's right for you, come and have a chat with us. We're more than happy to talk it through with you. These things always seem more scary than they really are. So it's good to chat it through, and you know you're in good hands. It will be very supportive.
Last word to Nadia, I think.
Thank you all very much to attend to our webinar, and we wish you a nice weekend, and hopefully we will see you in May in London. We will be there.
Thank you. And thank you to Angela Palomares, who has been forwarding our slides for us. We look forward to seeing you May 24th, London. Yeah, just please get in touch. And I'm delighted we already have some applicants. So